We have another EKG case here, 78-year-old female with dizziness. First, we're going to start out with the rate. Let's look at lead 2. I mean, just by looking at it, definitely is bradycardia, but just to make sure, we're going to count it out. 300, 150, 100, 75, 60, 50, 43, and then a little bit over here, it's 37. So we'll say a little bit like in the 40 beats per minute range. Definitely bradycardic. Next, look at the rhythm. In leads 2, see R-to-R invo, looks pretty regular rhythm to me. Let's look at the access. Lead 1 is going up. Let's look at the AVF is going down. Lead 2 is going down. So then they're looking at, now we're looking at left axis deviation. And then next we're gonna check for PR intervals. Well, looking right here, it's kind of hard to see any P waves at all. So, because I don't see any P waves, I'm going to say that's and the rate is between 40-60 beats per minute. I'm going to call that a AV junctional rhythm because no P waves there. And then let's look at the QRS complex. They look like they are less than 0.12 second. And let's look at the QT interval. I don't see any QT prolongation there. Any ST elevations? I don't see any ST elevations at all. And now we're going to look at any bundle branch block. I do note that there is this thing that looks kind of pathognomonic for a bundle branch block. Also these bunny ear right here. I see these bunny ears. So let's look at V1. I do see an RSR prime. And since it's going up, I'm going to call that a right bundle branch block. Overall, in general, we could say, you know, this is the sinus node is not feeling too good, and we're going to call this a sick sinus syndrome in this patient.